Hey everyone, ready for another deep dive?
Always.
Awesome. Today we're going to be looking at AI and robotics in medicine.
Yeah, some really interesting stuff.
Yeah, I've been looking through this research paper, The Application of Artificial Intelligence and Robotics in Medicine, Current Status and Future Perspectives.
Right.
And it's amazing to see how this tech is already being used. I mean, robots in surgeries, AI diagnosing diseases.
Personalized treatments based on your genes,
It's
even.
mind-blowing.
Yeah, it really makes you think about the future of healthcare. What it means to be a patient.
Totally. So let's start with AI's role as, like, the doctor's new assistant.
Okay, yeah.
So imagine you're a radiologist, right? You're spending hours looking at X-rays, CT scans, all these images.
Right. Tons of images.
AI is getting really good at analyzing those images quickly and accurately.
Yeah, and I mean it's not just saving time. AI is sometimes even better than human doctors at spotting like tiny details in the scans.
Yeah, the paper gave this example of diabetic retinopathy,
Right.
that eye condition. AI can detect it with something like 90% accuracy,
Yeah, sometimes even better than ophthalmologists.
which is, that's incredible. Think of how many people could keep their vision because of that.
Millions, potentially.
And it's not just radiology, right? AI is making waves in pathology too, helping to classify tumors and finding things that even experienced pathologists might miss.
Yeah, and it can lead to faster and potentially even more accurate diagnoses, especially for, things like cancer.
Right, so AI is kind of like this superpowered assistant working with doctors, helping them make better decisions.
Yeah, and I think that's an important point, right? It's augmenting human expertise, not replacing it.
Totally. Doctors can then focus on the things that AI can't do,
Exactly, like connecting with patients, making those tough judgment calls.
the human stuff.
Yeah, exactly.
So speaking of AI lending a hand, the paper also talks about clinical decision support systems, CDSS.
Oh yeah, those are getting pretty interesting.
Right, so imagine you're a doctor. You're trying to decide on the best treatment plan for your patient. The CDSS is like having a super smart consultant by your side.
Yeah, it can analyze all sorts of data, medical history, symptoms, all the latest research, and then it can give the doctor evidence-based recommendations.
So it's like having access to a huge medical library, but it's all tailored to that specific patient.
Right, exactly.
But the paper did mention there can be some pushback. Some doctors are hesitant to rely on AI for those big decisions.
Yeah, well, I mean, it is a big change. Plus, there are concerns about data accuracy.
Right. The AI is only as good as the data it's trained on.
Exactly. You feed it bad data, you're going to get bad recommendations.
Garbage in, garbage out.
Right. And then there's the whole issue of how you actually integrate these systems into a busy hospital or clinic.
Yeah, it's not as simple as just flipping a switch.
Definitely not.
Okay, so we've talked about AI as a doctor's assistant. What about robots actually performing surgery?
Oh, wow. Yeah. That's becoming much more common.
That sounds like sci-fi, but it's actually happening.
It is. The paper highlights the Da Vinci surgical
The
system.
Da Vinci system? I think I've heard of that.
It's pretty amazing. Imagine a surgeon sitting at a console
Okay.
and they're controlling these tiny robotic arms, super precise.
Oh,
These arms hold miniature surgical instruments, a 3D camera. The surgeon can operate through tiny incisions.
so it's like the surgeon's hands, but way more precise.
Exactly. And get this, the number of Da Vinci systems being used has like skyrocketed.
Really.
Yeah, it's especially popular for urology and gynecology.
So it's not just a cool concept anymore. It's actually becoming the preferred method.
For some surgeries, yeah.
What are the advantages of using it?
While the incisions are so small, patients recover faster.
Less pain, less scarring.
Exactly.
That makes sense.
And it can be incredibly precise, important for delicate procedures.
But how do the surgeons even learn to use this system?
Yeah, the paper does mention that there's a steep learning curve. It's not easy.
Right. And I imagine these systems aren't cheap.
No, they're expensive to buy and maintain, so not every hospital can afford them.
So it's a cutting-edge technology, but it's still evolving.
Yeah, definitely. But even with those challenges, the paper shows the benefits: lower complication rates, less blood loss, shorter hospital stays.
So it sounds like robotic surgery is really pushing the boundaries of what's possible.
Yeah, it's a game changer, and I think we're just seeing the beginning.
Okay, so AI as an assistant, robots in the operating room. What about personalized medicine? I'm really curious about that.
Oh yeah, personalized medicine is it's huge right now.
It seems like everyone's talking about it.
And the paper actually has a whole section on it. It talks about how AI is revolutionizing personalized medicine, analyzing tons of genetic information, and tailoring treatments to each patient.
So instead of this one-size-fits-all approach, treatments are designed for your specific genes.
Precisely. AI is being used to analyze these massive data sets and identify those genetic markers that are linked to specific diseases.
Wow. So it's like having a treatment plan that's written just for you.
Yeah, that's a great way to put it. But AI can also analyze a patient's genetic profile to predict their risk of, developing certain diseases.
So it's like a crystal ball for your health. That's kind of scary, but also really cool.
It's definitely powerful. But remember, it's not about predicting the future with like 100% certainty.
Right.
It's about providing valuable insights, helping guide decisions about healthcare.
Okay, that makes sense. So more like a personalized health forecast.
Exactly.
But what about the challenges of personalized medicine?
Oh yeah, there are definitely challenges. For one thing, we need huge data sets to train these AI algorithms.
Right. And those data sets need to be diverse too.
Exactly. And then there's the cost.
Yeah, personalized medicine can't be cheap.
It can be more expensive than traditional approaches, at least at first. But, as the technology gets better and more widely used, the costs should come down.
So it's an investment in the future.
I think so. It has the potential to really change how we prevent and treat diseases.
Wow, this is seriously amazing stuff. We've gone from AI diagnosing diseases to robots doing surgery and now personalized medicine.
It's an exciting time to be working in medicine, that's for sure.
So we've covered a lot in this first part of our deep dive. What else is in this paper that we haven't touched on yet?
Oh, there's so much more. We haven't even talked about robots that can help with regaining mobility after a stroke, or social robots that can provide companionship.
Wow, there's so much more to uncover.
There is, and we'll dive into all of that in the next part of our deep dive.
Can't wait. We'll be back soon to continue exploring this incredible world of AI and robotics in medicine.
It's going to be great.
Welcome back. I'm really excited to keep going with our deep dive into AI and robotics in medicine.
Me too. There's still so much to talk about.
We left off talking about personalized medicine.
Right. And, speaking of personalized approaches, let's talk about rehabilitation robots. They can really be life-changing for people with mobility challenges.
Rehab robots. I don't know much about those, honestly. What are we talking about here?
So think about someone who's had a stroke, right? Or a serious injury that makes it hard to walk.
Okay, yeah.
Rehab robots can help them regain that mobility through targeted exercises and assistance.
So they're like robotic physical therapists?
Exactly. The paper talks about these robotic exoskeletons. They can support the patient's weight and guide their movements.
Wow. It's like having a personal trainer, but it's a robot.
Right. And the research actually shows that this kind of robotic rehab can really help.
It does?
Yeah, it can improve motor function, strength, and just overall mobility.
That's incredible. But what about the cost? These things can't be cheap.
Yeah, you're right. The paper does mention that cost and access are big challenges. These systems are expensive.
I bet. So not everyone who needs one can get one.
Unfortunately, no, but hopefully as the technology improves, they'll become more affordable.
Yeah, fingers crossed. It would be amazing if everyone who could benefit from this tech actually had access to it.
Absolutely. And you know what else is really cool? The paper talks about combining robotic therapy with virtual reality.
Whoa, wait, VR. How does that even work with rehab?
So imagine you're wearing a VR headset, right? You're immersed in this virtual world, and you're using a robotic arm to like reach for things, navigate obstacles, even play games.
So it's like turning physical therapy into a video game.
Exactly. And the research suggests that this combo, robotic therapy plus VR, can actually be really effective.
That's amazing. It sounds way more fun than regular physical therapy.
Right. And the VR can be adjusted to each patient's needs and abilities.
So it's really personalized?
Exactly.
That's so cool. Does it actually work though? Like, does it really help people recover?
The research is really promising. It suggests that it can enhance not just physical recovery, but also cognitive function.
Really? So it's not just about muscles and movement.
Right. It can stimulate the brain, help with thinking and memory.
Wow, that's amazing. It seems like we're like on the edge of a whole new era in rehab.
I think so. Technology is helping people overcome limitations that that we might have thought were impossible to overcome before.
It's incredible. But I guess even with all this amazing technology, the human element is still important, right?
Oh, absolutely. The therapists, the support from loved ones, the patient's own determination, all of that's crucial. Technology is a tool, but it's not a magic bullet.
Right. It takes a whole team. Okay, so we've talked about robots helping with surgery, robots helping with rehab. What about what about the emotional side of things?
The emotional side.
Yeah, can robots like provide companionship, emotional support? I mean, those seem like such human needs.
That's a really interesting question, and it's something that researchers are definitely looking into. This paper actually talks about social robots.
Social robots, I've never heard of those.
They're robots that are designed to interact with humans in a more social and emotional way. They can talk, answer questions, even express emotions.
Whoa, wait, so we're not talking about robots that look like people, right?
Not necessarily. They might not look human, but they can understand our language, recognize our emotions.
And respond in a way that's like empathetic.
Ex-
That's pretty wild. I can see how that could be helpful for people who are lonely, or maybe in hospitals or long-term care facilities.
Right. Think about elderly patients who are isolated. A social robot could keep them company, help them stay connected with family and friends, even remind them to take their medication.
That's amazing. Could these robots actually replace human companionship, though?
That's a tough one. A robot can't replace the warmth of human connection, but the research does show that social robots can have a positive impact. They can reduce loneliness, improve mood, even encourage people to be more social.
Wow, that's really encouraging. So it's not a replacement for human connection, but it's something that can help.
Exactly. And as the technology gets better, we'll see even um, more sophisticated social robots.
Wow, this is also fascinating. It seems like the possibilities are endless.
It does feel that way, doesn't it? And we're just getting started. There's so much more to explore.
Well, I'm ready for more. What else does this paper talk about?
We've talked about robots in surgery, in rehab, even for companionship, but there's one more area that's really essential for the future of healthcare: personalized medicine.
Personalized medicine. I think I've heard that term before, but I'm not really sure what it means.
Sure, basically it's about tailoring treatment to each individual patient based on their genes, their lifestyle, all sorts of factors.
So instead of everyone getting the same treatment, it's more customized.
Exactly, and AI is playing a big role in making that happen.
How so? I mean, I can see how AI could analyze a patient's medical history, but how does it help with personalized medicine?
AI is really good at analyzing tons of data, like genetic information, medical records, even things like diet and exercise habits. And by looking at all that data, AI can help identify patterns and predict how people might respond to different treatments.
So it's like having a personalized health forecast that can help doctors make better decisions.
Right. And the paper gives some really interesting examples, like AI algorithms that can analyze a patient's genes to predict their risk of developing certain diseases, like cancer or heart disease.
Wow, that's incredible. But it also sounds a little scary.
Yeah, I get that. It's definitely powerful technology. But it's important to remember that it's not about, predicting the future with 100% accuracy. It's about providing information that can help guide treatment.
So it's more like a tool to help doctors and patients make better decisions together.
Exactly.
This is all really amazing stuff. It seems like personalized medicine could really revolutionize healthcare.
I think so too. But like with any new technology, there are challenges.
Like what?
Well, one big one is data privacy. We need to make sure that patient data is being used responsibly, and that people have control over their own information.
Right. That's a really important point.
And another challenge is making sure that these AI algorithms are fair, that everyone has equal access to the benefits of personalized medicine, no matter their background.
Yeah, that's really important. We don't want to create a system where only certain people benefit.
Absolutely. It's about using technology to make healthcare more equitable for everyone.
This has been such a fascinating conversation. I feel like we've only just scratched the surface of what's possible with AI and robotics in medicine.
I agree. There's so much more to discover and explore.
So to wrap up this part of our deep dive, we've talked about rehab robots, social robots, and the rise of personalized medicine. It's amazing to see how technology is changing healthcare.
It really is, and it's just the beginning.
Well, I can't wait to hear what else this paper has to say. What are we diving into next?
In the final part of our deep dive, we'll be looking ahead to the future, the challenges, the ethical questions, and all the incredible possibilities that are still to come.
That sounds awesome. I can't wait.
Me neither.
Welcome back to our deep dive into AI and robotics in medicine.
Yeah, it's been a fascinating journey so far.
It really has. We've covered so much ground already, from AI-powered diagnosis to robots in surgery, rehab, even companionship.
And personalized medicine, don't forget about that.
Oh yeah, personalized medicine. It's amazing to think about how much technology is changing the face of healthcare.
It's incredible, isn't it? And I think this research paper does a really great job of showing us both the incredible potential of these technologies and, the challenges that we still need to address.
Totally. So let's talk about the future. What does this paper tell us about the direction of AI and robotics in medicine?
Well, one thing that really stuck out to me was the emphasis on collaboration. The paper talks a lot about the importance of researchers, clinicians, policymakers, and even patients, working together.
That makes sense. It's not just about the tech itself, right? It's about how we use it to create a better healthcare system for everyone.
Exactly. And I think that requires, open and honest conversations about the potential benefits and the potential risks.
Yeah, we need to make sure that everyone's voice is heard.
Absolutely. And another key takeaway from the paper is the need for ongoing research and development.
Right, because this field is like constantly evolving.
Exactly. There's always something new to learn, a new challenge to tackle.
I love that. It keeps things interesting.
He does. And, at the end of the day, it's all about using this technology to make a real difference in people's lives.
I think that's what makes this whole field so exciting. So even with all the challenges, it sounds like this paper is pretty optimistic about the future of AI and robotics in medicine.
It is, and I think that optimism is grounded in the belief that these technologies, when used, responsibly and thoughtfully, have the power to really transform healthcare.
It's been incredible exploring all of this with you. As we wrap up this deep dive, is there one message you hope our listeners will take away from this conversation?
I think the most important message is this: the future of healthcare is being shaped right now, and we all have a role to play. Whether you're a patient, a doctor, a researcher, or just someone who's curious about these topics, it's important to stay informed and engage in these conversations.
I love that. And as AI and robotics continue to evolve, we'll be here to keep you all informed and hopefully inspired by the possibilities.
Absolutely.
Thanks for listening, everyone. We'll catch you on the next deep dive.